Breaking the wall of exercise in lung disease. Marieke Wuyts, Falling Walls Lab, Leuven.
This is how a patient experiences a flare-up of chronic obstructive pulmonary disease, COPD. They describe it as feeling like they are suffocating or drowning just because they cannot breathe. They need medication, and sometimes a hospital stay is required. In Belgium, around 800,000 people suffer from COPD. It is developed due to years of tobacco smoking, which causes a destruction and inflammation of the small airways in the lungs. The result is patients being short of breath on a daily basis. It becomes difficult to perform daily tasks such as household activities, playing a game with friends and family, or just even simply walking or getting dressed. Now, the impact of such a flare-up is not limited to the lungs alone. With each flare-up, patients lose muscle strength, around 1% per day in the first week, and they reduce their physical activity. This will lead to an increased risk of a new flare-up and further deconditions the patient and increases the risk of mortality. Now, these patients, it's clear that they need rehabilitation to stop this downward spiral from happening. Pulmonary rehabilitation is a very effective program. We can improve symptoms, reduce survival, and reduce the hospital admissions. But there is one big problem. Less than 10% of patients actually follow such a program after a flare-up, and many don't finish it. Why? Well, there are travel issues, the program lacks flexibility, and sometimes patients believe they are too good to follow the program, or the opposite, they feel too bad to follow the program. So in order to lower the bar of patient participation, we need the program to change. We developed an exercise training program in primary care that is tailored to the burden and consequences of a flare-up. Patients perform strength training of the lower legs while using minimal equipment, such as an ankle weight, elastic bands, or a step. Now you might wonder, why are we doing strength exercises for a patient with a lung condition? Well, here's the logic. Patients lose muscle strength, but trained muscles use oxygen more efficiently. So if we strengthen the legs, we can reduce the oxygen demands in the muscle of the legs, which can ultimately reduce breathlessness and provide the opportunity to improve physical activity. Now, we might not be able to break down the wall entirely, but we can certainly lower it, allowing for more personalized, tailored rehabilitation for patients experiencing a flare-up of COPD. Thank you.